I want to start with sort of the what it isn't, or what you hear from your patients, and what their misconceptions or concerns might be when they first hear those two words, palliative care.
Yeah, so palliative care has a lot of power. The words have a lot of power. I think people often have a strong emotion when palliative care is brought up in their care trajectory. Um, I think initial thoughts are, is my doctor giving up on me? Am I dying? Is this a place that I go to? Does that mean I can't get chemotherapy anymore? I think there's often a lot of fear around the term palliative care. And with that fear comes a level of anxiety and resistance that, they're not ready for palliative care. Interestingly, patients are not alone. Doctors sometimes feel that way too. We'd often recommend a consult for palliative care, and physicians will say, well, my patient's not ready for that yet. We're not at that point. We still have a lot of treatments to offer. And so I think there's this very strong connotation that palliative care means that we are not offering additional treatments, or that we are transitioning care, or that we are approaching end of life. And that raises fear appropriately for patients and families when it's introduced to them.
So it's interesting that you say even physicians maybe misunderstand the role that palliative
Yeah,
care should play, and that there's confusion even within healthcare professionals around palliative care versus hospice or end of life care. Equally as important, but totally different.
totally different.
Um, so we've got a lot of work to do on both ends in educating, it sounds like the healthcare professionals as well as the patients as to why they shouldn't be fearful of palliative care. Can you talk a little bit and give us some examples of what palliative care actually means? What is it?
So, palliative care in the strictest sense means to relieve suffering. So, it means to relieve suffering. When we are given a diagnosis of a serious illness, and we move from that phase of our life where we've always felt healthy, like nothing could defeat us, and then suddenly we are vulnerable. We are vulnerable in a way that we have never been before. And we're vulnerable mentally, physically, socially, existentially. We've moved from that phase of healthy to not healthy, from well to sick. There is a form of suffering in that. And that suffering is quite great. And I think that the role of palliative care is really to relieve that suffering and to create pathways forward that even with serious illness, even with a diagnosis that's affected your identity and affected your social life and affected your medications, there's still a really clear path forward where you can have control and you can have good quality of life and good function and you can achieve your goals. And so it's really about relieving that suffering and about creating that pathway forward that's about empowerment at all of those different levels, whether it's physical, psychosocial, spiritual, but creating that robust way to help people to continue to fight, to stand, to be with their illness.